is my pleasure to introduce Lisa Gomez, who was sworn in as Assistant Secretary for Employee Benefit Security in October 2022. Previously, Gomez was a partner with the law firm Cohen, Weiss and Simon LLP and the chair of the firm's management committee. She has deep technical and practical experience in the multifaceted field of employee benefits law and has spent almost 3 decades representing various Taft-Hartley and multi-employer pension and welfare plans, single employer plans, jointly administered training trust funds, a federal employees health benefit plan, supplemental health plans covering employees in a wide range of industries. She is a graduate of the ABA section of Labor and Employment Law's Leadership Development Program and served as the union co-chair of that program. Lisa was named as a super lawyer for employee benefits on the Super Lawyers New York Metro annual list for 2021 and 2022, and she earned her law degree from the Fordham University School of Law and her undergraduate degree from Hofstra University. She's going to speak to us about mental health parity. Please join me in welcoming Lisa Gomez.
Good morning, everyone. It's really great to be back here in Los Angeles. Was here a couple of months ago, meeting with several folks who I see familiar faces in the room, and had the opportunity to reach out with both Representative Napolitano and Rep. Porter, just trying to get the word out as Dr. Gailey said before me, about the resources that are available to all of you. And again, I echo his thanks for everything that you all do on a daily basis to support families that need help as they're living with mental health and behavioral health issues. So I'm Lisa Gomez. And I have the honor and privilege of serving as the Assistant Secretary for the Employee Benefit Security Administration, which is an agency within the Department of Labor for the United States. And I want to thank NAMI Greater Los Angeles County for inviting me to participate in today's conference. So I'd like to start with a few things that we all know. Mental health is essential to personal and societal well-being. And the United States is in the midst of a mental health and substance use disorder crisis that just worsened with the COVID-19 pandemic. And that crisis impacts everyone. It impacts children and adults across various demographics nationwide and disproportionately affects folks who are in marginalized and underserved communities. And so the focus on mental health currently is really just so critical. And again, so happy to see you all gathered here today to work towards better serving or continuing to serve this community and trying to work towards parity. So 15 years ago, the Federal Mental Health Parity and Addiction Equity Act, or MHPAEA, was enacted to ensure that people who seek mental health and substance use disorder treatment do not face greater barriers in receiving benefits and accessing that treatment than they would face when seeking medical and surgical treatment under the same health coverage. And while some progress has been made over that 15-year period, people living with mental health conditions and substance use disorders just continue to face greater barriers and restrictions when trying to seek care. These unlawful limitations require people living with mental health conditions and substance use disorders to run faster, jump higher, and clear more hurdles just to get the benefits that their plan promises. And this is wrong, and it violates the law, and it simply has to stop. Now, I've been there myself, and I've seen firsthand how difficult it can be for a person living with a mental health illness or a substance use disorder, as well as their family and friends. I've experienced the pain of losing friends and family members to suicide and overdose. I also know that people with mental health conditions and substance use disorders can manage those conditions and lead meaningful, fulfilling lives if they can just access the care that they need in the same way that they can for their medical conditions. It can be hard enough to decide that it's time to seek help. It shouldn't be so difficult to get that help, and it simply shouldn't be harder for someone to get care for severe anxiety than it is to get care for severe wrist pain. So I've told you many things that you already know. So let me tell you some things that perhaps you don't know. Um, so as the immortal Tina Turner once said, what's EBSA got to do with it? So, okay, she never actually said that, but if she was still among us and I asked her who EBSA, she would probably say that. Well, the Employee Benefit Security Administration, or EBSA, and I'll borrow from the prior speaker to say, if you take anything with you from the speech today, aside from taking the thanks and the gratitude that we have for all of you, which is incredibly important, I'll ask that you also take the name EBSA and the knowledge that there is a federal agency that exists that is dedicated to protecting the health and retirement benefits of America's workers across the country. And specifically, we are very focused on protecting workers and their families who are needing to access mental health care and substance use disorder care. And we have regional offices across the country. We have a regional office right here in Los Angeles, in the Los Angeles area, I should say. I have two wonderful colleagues from that office here with me today. And we have a toll-free number that the last time I met with several of you, I said I was going to get it tattooed on me so that I would remember, but now I've said it enough times that one day I will get a tattoo. As much as I love the agency, it will not be the number of the agency, but it is 1-866-444 EBSA, or 3272. And Tui is nodding, so I know I got it right. But we are an agency within the Department of Labor, and we regulate about 2.5 million private employer health benefit plans in the United States. The health plans that we oversee cover over 130 million people. So most people who have coverage in the United States who are under age 65 are covered by a health plan that we at the EBSA regulate. So we have a very broad jurisdiction of folks that we cover, and we are responsible for regulations, enforcement of the laws, compliance assistance, outreach, and education with respect to all of those plans. So now that you know what EBSA is, let me tell you what we're doing at EBSA and within the administration about mental health parity. So in an effort to pave the pathway to parity, the United States Departments of Labor, Health and Human Services, and the Department of Treasury issued proposed rules in late July of this year, which are necessary to strengthen the protections under that federal Mental Health Parity Act, provide additional clarity for group health plans and group and individual health insurance issuers, and to better equip the departments and the states to more effectively enforce MHPAEA's protections. We are working really hard to identify, address, and eliminate the roadblocks that currently make it difficult for American families to access mental health care and treatment for substance use disorders. Whether it be access to care, network adequacy, application of guidelines, reimbursement rates, exclusions, we are reviewing it all. Now, these proposed rules are aimed at strengthening and reinforcing MHPAEA's protections, taking into account feedback that we have received from interest parties and the experience of the departments ourselves in enforcing the law. We started these rules with a purpose section so that as we're implementing the rules, we're making it clear and constantly driving people back to the why, the need to remove barriers to mental health care and treatment for substance use disorders. We also, in the late summer, released our 2023 report to Congress on MHPAEA compliance, which showed that plans and issuers continue to fall short of MHPAEA's central mandate, even though it's 15 years later, to ensure that participants, beneficiaries, and their families do not face greater barriers and restrictions to accessing benefits for mental health conditions and substance use disorders than they face when accessing benefits for a medical condition or a surgical procedure. And while there's been some improvement, we are at a point where we just can't waste any more time. I want you all to know that the Biden-Harris administration and the Department of Labor and the EBSA all consider making mental health parity a reality, a top priority. This issue is personal to the president, just like it is to all of us. President Biden addressed mental health parity in his State of the Union address this year, and he held a special White House event when we were announcing the proposed regulations this summer. He has given a mandate to the entire federal government on this issue, and we're thrilled to have such strong support from the very top on this really critical issue. Acting Secretary of Labor Julie Su met personally with mental health advocates and families to hear firsthand their stories, which are the reasons that we do what we do. At the EBSA, we have devoted an unprecedented level of resources to enforcement of MHPAEA through investigations throughout the country, regulatory and sub-regulatory guidance, and compliance assistance and education. We also earlier this year launched a MHPAEA outreach campaign, which is aggressively moving to provide information through social media, community outreach, other media opportunities, and other initiatives to try to get the word out about what mental health parity is and how EBSA can help people who are facing barriers in obtaining care. I have made it my mission as Assistant Secretary to really reinvent the way that we at EBSA are thinking about stakeholder engagement and outreach. I talked with so many families, either just in my current position or talking with family and friends who will share with me some of their stories. And I am sad to say that when I tell them, this is what I do, and this is the agency that I work for, and we can help, pretty much no one has ever heard of us and what we can do for families. And I have to tell you that the people who are on the other side of that toll-free number are so committed to helping folks get to the right place and to get the help that they need. And I have some great stories that I'd like to share with you about that. It's just a resource that is completely untapped. So we're trying to change that. We're also engaging directly with members of Congress to make sure that they know who EBSA is and that the role that we play with respect to mental health parity from a regulatory enforcement and outreach and education perspective. It's been a learning process for sure, but we are making headway. Different members of Congress are engaging with us, whether they're looking for us to provide them with technical assistance on legislation, visiting with mental health advocates, as I did when I came here at the end of the summer, or increasing awareness of the services that EBSA provides to participants and their families in getting the care that they need. We received a large number of comments in response to our proposed rule, and we are reviewing them with an eye towards coming out with a final rule very soon. I In meetings that I've had with stakeholders who are concerned about how to comply with the regulations and with mental health parity, I'm telling them point blank that I don't want to hear from them that it's just simply too hard and that they can't do the things that we're asking them to do. We understand that there are challenges, but the response is not to just throw your hands up and give up. The response should be to sharpen your pencils and work together to finally address those challenges. So moving forward, EBSA is going to continue to be here and to continue to reach out to the public and help folks understand that they have rights and that they can exercise those rights. And if they need help understanding their plan or getting what they're entitled to, they should contact our EBSA benefits advisor at 866-444-3272 or EBSA, or send an email to askebsa.dol.gov. Yes, 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 it's 866. I should have like a thing. Well, we're working on our performance skills. So, next time I'll have but it's 866-444-3272. And the 3272, I also discovered here in California stands for EBSA. Which I couldn't understand why we didn't just say EBSA, but there's a long story behind it. But or it's ask EBSA, askebsa.dol.gov. Gov, G-O-V. Oh, ask EBSA.dol.gov. I really do need, I'll get a t-shirt made or something for the next time. I do want to share some stories because they are some excellent stories and they give you an idea of things that we've done. So these are stories of families who have contacted us at EBSA with mental health and substance use disorder challenges that they are trying to work with in obtaining access to care and how we've helped them. There was one case in which an in-network hospital, a mother could not find an in-network hospital to provide mental health treatment for her daughter. And so she was forced to seek treatment at an out-of-network facility, which required her having to get a second mortgage on their home. EBSA was able to help by getting an exception under the plan's mental health benefits, which ultimately reimbursed the mother over $200,000. And she was able, thank you. I just get to tell the great stories and take credit for the wonderful work that these people do. Not even to take the credit, but just to share with you the things that they do. And she was able to pay her second mortgage. EBSA also investigated a mental health plan that excluded coverage for applied behavioral analysis therapy, which, as many of you know, is a treatment therapy for autism. And the plan, after the investigation, was required to revise its terms to cover this benefit and had to reprocess over 1,100 claims, totaling over $630,000. In another story, a plan approved mental health treatment for a teen at an out-of-network facility because there were no in-network providers, but the plan later didn't honor the exception it provided and denied the claim for over $92,000. I met the mother of this child at the event that was at the White House when the regulations were, the proposed regulations were announced. And she told the story about her daughter being in this facility and not knowing how she would ever be able to cover these bills once she was told that the coverage was had been provided in error and would not be continued. This was the one person who told me that she actually had heard of EBSA. But as I was telling one of my colleagues on the way over here, she just happened to be listening to an NPR program and heard a colleague of mine at EBSA talking about the work we're doing on mental health parity. And she just happened to know someone who worked at the Department of Labor. and asked her friend at the Department of Labor who this EBSA agency was. And we were able to connect with her and conduct an investigation that resulted in the plan reversing its decision and paying the claims at the in-network level as it had previously approved. And that's a great story, but for the fact that um, that mother really only got help out of luck. She just happened to be listening to that television radio station, and she just happened to know someone at the Department of Labor. But it shouldn't take luck to get help, and we're available, and hopefully you can help spread the word. There was another plan that denied benefits for residential treatment for substance use disorder, and an EBSA investigation resulted in the plan amending its terms to include residential treatment for mental health and substance use disorder. And the participant that was affected had a claim of almost $57,000 denied. But after the plan updated the policy, the claim was paid. So these are just some stories that we have that are really amazing stories. But sadly, there are several stories where we're not successful. It may be that we're unable to prove that the plan violated the law and that the plan is not willing to change its terms. It may be that we're not successful because we're just not able to resolve it in time. And sadly, lives are lost. And I can tell you that the people that I work with at this agency, we have 120 benefits advisors across the country. We have investigators across the country, but we are a very small agency as agencies go. We have under 900 employees across the country, and the ratio of investigators to plans is one investigator for over 12,000 benefit plans. So we simply can't do all of the work, but we are really trying, and we're the little agency that could. And hopefully Congress will see to it to give us some more money so that we can do more here. We are determined to make sure that workers and beneficiaries get their due, and there's a lot that needs to be done, but we stand ready to move forward, and we are thankful for the incredible support of advocates like NAMI, and together we can achieve great progress. So thank you, and I hope you have a really thoughtful and productive conference. Thank you.